Today on my YouTube channel, we're doing the walkthrough of how to use the Teeter inversion table. I'm not sure what version this is, but it is a new, not new, I had this for a couple of years. So what this will do is help you relieve some of your back pain. It won't get rid of your back pain. It'll help separate your back. Sometimes you'll feel the joints separating if you stay on it long enough. So it can feel a little bit strange, and it also feels relief. If you have a lot of neck pain, you'll feel a temporary relief, like almost instantly. The blood does rush to your head, so you kind of feel like a major head rush. But I'm going to get on and show you this. So the way you put your feet in here, and then you pull up on this device here, and it locks your feet in. You'll hear it click. If you don't hear it click, then you haven't locked your feet in. So the way you know if it's locked in is you'll hear it click, and the button, well, this will not move anywhere. If you don't have it clicked, then it'll move all around on you. So basically, this is behind me here. Let me get out of here again. I didn't show you all the features here. So what this does here, you pull this pin out and you adjust it for your height. I am 6'2", and I'm a pretty well-balanced person, so it works for me on 6'2". But if you have a lot of stomach weight, it may not work as well on your exact height. But for me, because I'm a well-balanced person, I'm a skinny guy, I put it on my height setting of 6'2". It's perfectly level for me. But like I said, it doesn't always work out that way, because if you have a belly on you, that weight is going to push you forward, backwards, a lot faster than if you're a slimmer person like me. So I'm going to put my head back. You can see it rocks up a little bit. So everything that is done on this table is movement with my hands. If my hands are in this position, it's pushing my weight down. All my weight is going to be down, and I'm not going to move backwards. But the second I move my hands all the way back, watch what happens. And so if I'm going too far backwards, I move my hands too far back, and I go really fast. See, like that, and you can really hurt yourself. But that's why you have these handles here. So if you're uncomfortable with that, so at first I suggest you put your hands on the handles, because when you do this, you have complete 100% control of where you're at. But the problem with the handles is it is a little bit difficult to push yourself back if you're not used to it. You have to let your feet slide back and into the foot locks, into the footrest here. But I'm going to show you what happens when I control it completely by my hand motions. So I put my hands, and I'm going at a nice slow. Look how slowly I'm moving my hands. And so I'm not going very fast backwards. So right when you get to about here, you really start going forward with your hands a little bit, because all that pressure is on your back now. So you don't want to shove your hands back. You're going to fly backwards. All your hands are in control. You have to feel. Yeah. So one of the things that when I'm in this movement here, all the way back, I can take my hands and push a little bit, and you can feel. You have to be completely relaxed when you're in this position. If you're not completely 100% relaxed, your muscles will tighten up, because you might not be relaxed because this is the first time you use an inversion table in your life. And so the way you relax is you focus on your back, your backbone, and you just concentrate on your backbone. And you say, wow, I can really feel it's relaxed, and your side muscles are not holding. All the pressure is relaxed now. So you're not feeling a lot of pressure. Now, this device goes into a complete inversion. So when we go back here, I can flip completely over 100%. Now the backboard is going to actually leave my back right at that position, and I'm going to free fall hang here. So the way I get out of this is I pull on the backboard, and I go back up like that. But that's a very advanced move, and I don't suggest it for everybody unless you're comfortable with your inversion table. It is not really that bad. So remember, it's all based on hand movements. And I'm pushing forward now because I'm going back too fast. And now my hands are all the way over here. And so it's kind of difficult to get up out of this position. So I am going to use the handle a little bit and go like that. But you'll feel, if you can also rock it, what I call a rocking motion. And then you just go like this, back and forth. And that's kind of like a rocking motion. That'll relieve, because there's going to be a lot of tension on your head. The blood's all going to flow to your head, and you're going to feel a lot of tension. But it actually feels pretty good if you have a lot of neck pain, because you can feel the joint separating. So I'm kind of doing a rocking motion. Now this won't work if you have a big stomach. You might have to use your hands like this to do the rocking motion, and that'll relieve some of the head pressure as you're going back and forth. So there you have it, a basic overview of the Teeter inversion table. If you have any questions, please comment below. Please like and subscribe to our channel. That's Wonder Dan, and I thank you for watching. Bye-bye, everybody.